Hey, what's up you guys? I'm Dr. Sharma, and today we've got a few topics to cover. How many people are infected with coronavirus now? Where are we at with this COVID vaccine? And healthcare disparities in the UK felt by black females. Let's get started. The worldwide number of coronavirus cases peaks now at 20.7 million, and the death toll so far has exceeded almost 750,000. In the US specifically, which beats Brazil and India in the highest number of cases in the world, has hit 5.3 million confirmed cases and a death toll of 509 deaths per 1 million population, which is actually within the top 10 countries behind Belgium, Britain, Peru, Spain, Italy, Sweden, and Chile. Those are obviously some worrying numbers, but where is the US standing in terms of vaccine? According to a CNN report this past Monday, August 10th, a review of Moderna's clinical trials now shows that the vaccine this year is really unlikely, with a quote from vaccinologist Dr. Hotez from Baylor Medicine stating that there is just no way that a vaccine will be ready by Election Day, which is November 3rd. To update you guys, Moderna Therapeutics, an American biotech company based in Massachusetts, founded in 2010, is currently considered to be at the frontier formulating a vaccine using mRNA, specifically mRNA 1273, vaccine to induce anti-SARS-CoV-2 immune response in humans, which could create an antibody that binds to protein surface on the COVID virus. This surface protein, called spike protein, is how the virus actually enters our cells and wreaks havoc, causing the infection. The company recently entered phase 3, meaning that it is participating in human trials after the vaccine showed decreased infection rates in monkeys after being vaccinated. The US government in April awarded about $500 million to fuel their research as an incentivized stimulus to create a vaccine. They received another stimulus recently, August 11th, as the race for the vaccine continues. Now, Moderna is not the only company getting government dollars, as a total of $9 billion federal dollars is being given to a charcuterie board of different companies, also including Pfizer with BioNTech, Johnson & Johnson, and Sanofi. Currently, it's expected that the cost of each vaccine by Moderna will cost approximately $17 to $20, but this number has been changing frequently because, as recently as mid-July, the CEO was predicting that the price tag per vaccine would cost about $60 each. More on the race for a vaccine on another video. Who would have thought that race would be a barrier for proper healthcare equality, especially when it comes to black females in the UK navigating proper gynecological care? According to a research study by Embrace-UK, assessing the mortality difference between pregnant females of ethnic backgrounds in multiple hospitals across Britain, pregnant females with a black ethnic background were 5 times more likely to die as a result of complications from their pregnancy. Some of these complications include cardiac complications such as hypertensive disorders that could mistakenly be diagnosed as normal physiological changes attributed to pregnancy. You're probably wondering, how can this happen? How can someone who's gone through graduate school to become a medical practitioner be even remotely responsible for this healthcare disparity between people of ethnic backgrounds and individuals suffering from similar health issues? The answer may lie in bias, underlying racism, and just not taking someone's symptoms seriously. I'm a doctor, and trust me, I've definitely seen this in real time, and it's sad. One part of the article talks about a young mother named Latoya, who was dealing with pelvic pain for about 2 decades, being fobbed off with birth controls and low-dose NSAIDs until she said, quote-unquote, she cried helplessly in front of her general practitioner to be taken seriously. Finally, the practitioner agreed to do further testing, and lo and behold, she was suffering from fibroids in her uterus, which required surgical removal. An additional anecdote shared by a black woman in the article talks about how a physician disclosed medical information to her in a public patient waiting area, which made her feel worthless, and clearly is not confidential and lacks total patient autonomy. Frankly, that's unacceptable no matter what color your skin is, and honestly, I bet that would never have happened to a white woman. Let's be clear, it shouldn't happen to anyone. We may have different colored skin, but we all bleed the same color. Red. Unless you're an alien, in which case, back off, I'm not taking care of you, you're not getting any pain meds from me, go back to your planet. Please like and share, follow for more videos, comment and ask any questions below, and as always, take care.